My name is Cristina Montoya. I'm a registered dietitian, a Sjogren survivor, and advocate. This week's topic is Sjogren's safe swallowing strategies. As a reminder, the information provided in this program should not substitute the specific advice from your physician or healthcare provider. After this session, you will gain a better understanding of the following topics: Sjogren's and dysphagia, some red flags you should pay attention to, what should I eat and drink, swallowing medication safely, and key takeaways. This is week 3 of my Beat the Sjogren's Growth. I created this program to enhance the knowledge about the impact of Sjogren's on our digestive health and quality of life. So I'm really hoping that you're gaining more tips and a greater understanding of these conditions so you can advocate for your health next time you visit your healthcare provider. Just always post this slide in every week, because I like to highlight that Sjogren's disease is a complex, serious, multi-system inflammatory disease that is not limited just to Zika. Remember that there is a percentage of patients, I would say up to like 20% of patients, that do not present dryness symptoms. So this was a comment shared by one of the participants in my Beat the Sjogren's Blood survey, which I'm conducting to explore the digestive symptoms that the individuals with Sjogren's syndrome may experience. So this person I just broke my heart. I would like more diversity in my liquid diet. I miss chewing. I miss different tastes. My meals are all the same from day to day. And there are really key words in this message. Diversity, right? We tend to eat the same foods over and over because they're comfortable. We are afraid of getting any reactions or choking episodes. Then we have to modify our diet. So this person had to go to the extreme or just taking a liquid diet. Chewing, different tastes, right? So how saliva affects our taste buds, and they just become boring. They're the same meals from day to day. So let's begin by watching a video that explains the normal swallowing so then we can understand the abnormal swallowing disorders when we have Sjogren's. So it's just 1.5 minutes. I assure you it's a great video.
Swallowing, also known as deglutition, is the name for the process by which food goes from mouth to pharynx to esophagus. Swallowing has 3 phases: the oral or buccal phase, the pharyngeal phase, and the esophageal phase. The oral phase is the only voluntary part of swallowing. After food has been chewed and moistened with saliva, the resulting bolus is pushed to the back of the throat, called the pharynx, by the tongue. This involves the tongue rolling back to prevent food from going forward into the mouth. As this happens, the soft palate rises to prevent food from entering the nasal cavity. The pharyngeal phase begins when receptors in the oropharynx are stimulated. This triggers initiation of the swallow reflex, which is involuntary. This part of swallowing must be coordinated perfectly because the pharynx is the entrance to both the esophagus and the trachea. While the esophagus leads to the stomach, the trachea leads to the lungs. The vocal folds are located in the larynx, which is at the top of the trachea. The vocal cords close and the larynx gets pulled up as the epiglottis flips over the entrance to the trachea. The upper esophageal sphincter opens to allow the bolus to enter the esophagus. During the esophageal phase, food is propelled down the esophagus towards the stomach by waves of muscular contractions known as peristalsis. The larynx moves back down, and the epiglottis flips back up so respiration can resume.
So just like that, imagine about 70% of people living with Sjogren's experience some difficulty swallowing. And their causes are a combination of the lack of saliva and esophageal dysmotility, and also parasympathetic function damage. So there is miscommunication between the autonomous nervous system, so there you go, some dysautonomia, with the function of the involuntary part of the swallowing, which is around the esophageal phase. There's also a reduction, patients with Sjogren's had a reduction of the lower esophageal sphincter pressure. So it's that sphincter of that opening that is allows the food to allows the food to go into the stomach, but this sphincter is that it's made like a muscle ring that makes sure that the gastric content doesn't back up into the esophagus. So in Sjogren's patients, they seem to be a little bit weaker, which can cause GERD or gastroesophageal reflux disease and increase in the sensation of swallowing difficulty. There's also another condition that is not really related to Sjogren's, but is something that you want to keep in mind, that is called the eosinophilic esophagitis. So in this situation, there is a accumulation of white blood cells in the esophageal tract. And these white cells are not supposed to be there. They become inflammatory, and they also seem to be more responsive to allergens. So the treatment consists of mostly, there's a medication treatment, but there's also an elimination of the main 8 food allergens, which are fish, shellfish, peanuts, tree nuts, eggs, soy, milk, and wheat. Soy and milk and wheat, and usually milk and wheat are the ones that tend to trigger most of the symptoms. But it's important that the reintroduction of those foods are also part of the protocol, so then we can identify which ones are triggering the symptoms. But again, what is important to know is that it's just not the lack of saliva, but there's also an impaired neurological this situation here that is affecting the motility and the esophagus. But beyond Sjogren's, there are other risk factors, and now we know that there are more, not only because maybe there's a delay in the diagnosis, but more middle-aged women or older women are more diagnosed with Sjogren's. And aging in itself is an independent risk factor to develop a swallowing disorder. And it can range from 1 in 10 older adults or 1 in 3 older adults that can develop swallowing disorders independent of anything else. There's also cerebrovascular and neurological diseases. So think of a stroke, Parkinson's disease, Alzheimer's, dementia, Huntington's disease, head and neck cancer, trauma, esophageal disorders like the one that I mentioned, and another rheumatic disease like scleroderma. So when visiting your healthcare provider, make sure that you mention if you have experiencing any coughing or choking, if the food is sticking in your throat, if there's any changes in your voice, if there's recurrent pneumonia, because just like if you remember the video that we watched, if there's no protection of the airway, so maybe small amounts of foods or liquids are entering the airway, going into the lungs and causing pneumonia. So something to keep in mind. But not only tell the doctor, I'm feeling this, also describe how you're feeling. So how long you have had these symptoms, how often, so in which meals you're presenting the symptoms, what makes it better, what makes it worse. If you're actually having unusual bad breath, I know with the lack of saliva, we can actually have kind of bad breath or at risk of it. but with proper oral hygiene, we can minimize that. But if you still experience bad breath despite pristine oral hygiene, so it might be related to swallowing issues. Also, any sleep disturbances or change in eating habits. So if you're noticing yourself, you're changing the texture of certain foods. So how can you determine if is there a tool that can help you, or I can help your healthcare provider determine if you are at risk of a swallowing disorder? So this tool, E10, is a swallowing screening tool that is used worldwide to screen people quickly and easily at high risk of swallowing disorders. We know that the gold standards for the diagnosis of dysphagia is the video fluoroscopic swallowing study, and that will allow the speech language pathologist to assess how, using contrast in food, and to assess how the food is going down the esophagus. So that is one part that can help you determine. But before getting into that diagnosis or the usage of that diagnosis tool, you can use a screening tool. Bring it up to your healthcare provider. If the score is 3 or higher, you may have problems swallowing efficiently and safely, and then you should discuss this with your physician. So what should I eat? So I bring to you a few suggestions from the International Dysphagia Diet Standardization Initiative, where it recommends different levels of texture modified foods. In our case, in the vast majority of patients, which Sjogren's patients can probably manage with these recommendations. So think about the meats, make sure that they're cooked until tender. They're used in casseroles, I think like a tuna casserole or a shepherd's pie type of dish. Use like a dark meat, so from chicken or turkey, because they have a medium fat content, which will facilitate the swallowing. I personally prefer the plant-based alternatives, so legumes like lentils, chickpeas, beans. I find them easier to swallow. They're also, just depending on how you prepare them, they go very well with rice or quinoa, so that will make it even easier to swallow. If you love fish, make sure that it's cooked soft enough to break it apart easily with the side of a fork or spoon. Foods like sushi, that it has this mixture of textures, so it's the raw fish, and you have the sticky rice. It's probably not a great food combination for people with dysphagia. Then we have fruits with high water content. Make sure that you rinse the canned fruits. The canned fruits are very easy to swallow as well. And also adding fruits and vegetables to your smoothies will definitely facilitate your swallowing. Make sure that the grains are moistened, like risotto. It's one of my favorites. Or use other grains like quinoa, because they're easier to swallow and less sticky. There are other. So here's an example of a patient's handout from the organization or the initiative that I just mentioned. So they have classified the textures and the thickness of fluids in 7 levels. So the level 1 would be like the regular fluids, which is the water, and level 7 will be like regular food, so there's no modifications to it. And then in between are like the texture modified foods or liquids. So the level 6 will be like soft and bite-sized. If you want to learn more about this initiative, I am adding the website, and I'm also going to send you the link. And in this case, I think it's very specific as to how the food should be to prevent choking and coughing. One thing that is particular here is like the regular dry bed should be avoided or modified. So you can cut the crust off and make sure that you use a spread that is slightly high in fat, like avocado spread, ricotta cheese, a little bit of butter, just making sure that there's something that will help you facilitate the swallowing. Then also avoid or reduce hard or dry foods like chewing sticky foods. Think about like the nut butters, like peanut butter, like almond butter. I find it so difficult to swallow. Sticky mashed potatoes. So those are things to keep in mind. Crunchy or sharp foods, so like popcorn or crisp bacon or corn chips or chips, not only they're harder to swallow, but they also can cause injury in your tongue because there's no saliva to buffer the texture. So it may actually cause injuries and sores, mouth sores. Nuts, like I said, like almonds or nuts with tough skin. So think of cashews, or maybe let the nuts soak in water overnight to soften them up. What about water? So of course, I think you can spot someone with Sjogren's because they're always carrying the bottle of water, right? Water, what is like, it provides a temporary relief of the dry mouth. It actually can
Flax seeds and
flash.
chia seeds contain a substance called mucilage.
It can it can actually get rid of this little bit of saliva that we produce. So there's an alternative, like you could add a little bit of viscosity to the water by adding flax seeds to 1 liter of water. Let it soak overnight, then strain the seeds, and you can use those seeds in your oatmeal or your smoothies or anything that you can think of. Like, don't waste the seeds. But then the water that is resulting from soaking the flax seeds, it will be slightly thicker. So take those small sips throughout the day. If you want to change the taste of the water, so you don't want to kind of taste the flax, so add a little bit of cucumbers or fresh berries just to kind of add a little bit of freshness to that water. If you can't tolerate flax or chia seeds, or you actually having more difficulty swallowing liquids or even swallowing certain foods, there are commercial products that are used to thicken water and fluids to facilitate swallowing. One of my favorites is the Thicken Up Clear by Nestle because it contains xanthan gum. It's a powder that you can mix in your water or tea or juice or anything that you have, and it doesn't change the taste of it, but it really allows to swallow your foods and to have this really comfortable feeling down your throat and esophagus. But just consider to ask for a referral for a speech language pathologist. They're really the experts in assessing the severity of the swallowing difficulties. They can suggest strategies to swallow safely, to modify the textures. A dietitian can help you to also, we kind of create your meals. I'm lucky that I have some understanding of the swallowing issues. I worked as a dysphagia clinician a few years back, and I have used these tips to help me swallow. So swallowing your meds safely. It's always so tricky when it comes to pills, and we know we have to take them. But ask your doctor to switch to liquid, spray, or sublingual meds or supplements when possible. There are so many options out there these days. For instance, like omega-3s comes in liquid, the magnesium comes in liquid, vitamin B12 can be like a sublingual, put under your tongue. You have the vitamin D drops. You even have gummies. It might be easier just to suck on the gummy, making sure that it's like sugar-free. Also, avoid swallowing your pills with plain water or hot beverages. The problem with this is like the plain water, the water travels way too fast to the back of your throat. So what it does is doesn't really carry the pill down the throat. It just kind of gets stuck in your tongue. And the same thing happens with hot beverages. It tends to dissolve the pill before even swallowing. So it can get stuck in your throat or in your esophagus. So instead, try using milk, plant-based beverages, applesauce, or yogurt. A behavioral change is that you can try to put the pill on the tip of your tongue and tuck your chin slightly before taking a sip of liquid. This behavior can allow to protect your airway and prevent you from coughing or choking. It says some of the liquid medications can be put in the fridge and it will be much easier to swallow. And here are my takeaways. So please assess or ask the doctor to assess or adjust medications that worsen dry mouth. So think of antidepressants, pain medications, medical cannabis, anti-anxiety, antihistamines. But there are over 500 medications that can cause dry mouth, but it's worth just checking with your doctor or your pharmacist. Modify the texture or fluid consistency as needed. I don't know what I was thinking there, but just choose like softer textures, extra gravies and sauces. Another behavioral change will be alternating solids and fluids, complemented by repeated swallowing. But I understand that sometimes it's very difficult to just swallow dry food. So if it takes fluids, just take a small sips. It allows to combine your food and mixes it up with the fluids. So it forms a cohesive bolus and it's easier to swallow. Tell your doctor when your swallowing ability limits your day-to-day activities. Ask for a referral to a speech language pathologist, a registered dietitian, gastroenterologist, ENT doctor, or even a GI motility clinic. So there are alternatives there that can help assess and provide some treatments or at least some tips to help you improve your swallowing or to at least cope with those swallowing difficulties. So I hope you enjoyed this presentation. If you have any questions, please don't hesitate to email me or participate in the Facebook community. Let's get it activated. I don't have the community and the Thinkific course anymore. So if you have access to the Facebook group, that would be great. Ask any questions. And next week, we will be talking about bloating and heartburn. So I will try to cover that huge topic with at least some tips to help you cope with those annoying symptoms. So have a wonderful rest of the week.